Yeah, so interestingly, I actually wanted to be Jack Hanna growing up. Yeah, so director of the Columbus Zoo. I grew up in Columbus, Ohio, huge Buckeyes fan. But I thought, man, Jack Hanna's got it going on. And I grew up watching Merlin Perkins in the Mutual of Omaha's Wild Kingdom. He'd always throw his assistant Bob out there to wrestle the alligator. I'm like, I want to do that. But it always ended badly for Bob. And then Merlin Perkins never really got out and did it himself. So I'm like, I don't want to be Bob, I don't want to be Merlin Perkins. Like Jack Hanna, that's a local guy. But I realized there's only one Jack Hanna in the world. So to get his gig was a pretty limited, narrow tunnel to get into. My father's a physician, and I realized, well, that's the most interesting animal on the planet would be the human being. So I thought that's probably something I could see myself being able to do, but still pursue my interests in those other areas. The osteopathic school in Athens, Ohio really attracted me by their interview process, their campus, who their faculty were, what they were able to do to attract me to that school. I kind of figured I would look at my dad's alma mater, but Ohio University was just warm, welcoming, and really talked about what they would do to augment my education to make me a better physician, should I choose them. Versus a lot of other medical schools kind of said, if you're lucky enough to come here, you might make it through, you might not. Our job as physicians, typically primary care specifically, is to educate our patients on how to make better choices for themselves while we're looking for those kind of critical illnesses that we may need to step in and intervene. So a lot of it's education and a lot of it's awareness of illness. I want to hear from the patient who they are, what their interests are, and what their concerns are. A lot of what I do is trying to figure out what my patient wants and marry that up with what it is that I need as the physician for their health care. A overriding arch in medicine is first do no harm. I don't want to hurt the patient, and I don't want them to hurt themselves. So big red flags are tobacco use, alcohol use, obesity, any type of unsafe behavior that could lead to sudden incapacitation or even small injury that accumulates over time. When I was early in my practice, I'd dance around those things a lot and try and help the patients feel good about their choices and come to an awareness over time that maybe they needed to make some change. As I've gotten more experienced and realized I have such a limited interaction with folks, even if it's known them for years, sometimes now I got to be much more direct. And the first meeting is really the ideal time to do that, because you can look at somebody you've never met before and say, you smoke a pack of cigarettes a day? You know that's bad for you, right? You can't possibly never have been told this before. And I always enjoy kind of the different responses I get, because I can tell who really knows exactly what's going on and who actually hasn't really contemplated the fact that they are harming themselves. And there are plenty of people who do things all the time that could lead to self-injury, but they're not really aware that that's a dangerous behavior. My wife and I have 5 kids. And we chase our kids everywhere. I've got 3 in college right now. We've got a senior getting ready to graduate who does outdoor rec and leisure activities. We've got a junior studying computers and cybersecurity, and he's traveling abroad right now in Ireland. And I was blessed with the opportunity to go visit him and spend some time with him overseas. My daughter's playing college sports and studying as a freshman, so we love to go watch her play. Kansas City and all over different places. And we've still got 2 active kids here local, still living at home in the school play or on field hockey teams or just being asked to get run to the mall. So a lot of times, whatever my kids are doing, my wife and I want to get involved. So our downtime, if we're not chasing them, may involve getting a nap, going to church, like outdoor activities. And both of us are avid readers too, so it's always pleasant just to sit down, not have anything to do, read a book, relax with a cold drink, and not have the pager going off.